If you're under 65 and collecting Social Security disability, don't go anywhere. In today's video, we're going to go over everything you need to know about your Medicare options. Hi Medicare community, my name is Lindsay Malzone. I'm the Medicare expert for Elite Insurance Partners and MedicareFAQ.com. You're eligible for Medicare once you age in at 65 or once you've been collecting Social Security disability benefits for 24 months. After 24 months, you'll receive a Medicare card in the mail. This will include coverage for Part A and Part B. Part A is usually premium-free as long as you worked at least 10 years and paid into Medicare for 40 quarters. Part B comes with a monthly premium. The premium will automatically be deducted from your Social Security disability check each month. Now, if you're still working, you may have the option to delay enrolling into Part B to avoid paying the monthly premium. As long as your employer coverage is considered credible under Medicare, then you can delay Part B without incurring any penalties. As long as your employer has over 20 employees, then the coverage for group insurance is considered credible. If you don't have another form of credible coverage and don't want to pay the Part B premium and choose to delay, then you may start to incur late enrollment penalties. The good news is that when you age into Medicare at 65 later down the road, those penalties will reset. Since original Medicare comes with out-of-pocket cost, you'll want to enroll in some form of supplemental coverage. Once your Part B is in effect, your Medigap open enrollment period will begin. This enrollment period will last 6 months and give you the opportunity to enroll in a plan without having to go through medical underwriting. That means a carrier cannot delay you coverage due to your disability. However, there are some downsides to Medigap plans when you're under 65. In some states, carriers are not required to offer Medigap plans to those who are under 65. Some states do require carriers to offer at least one plan to those under 65. This is usually Medigap Plan A. Medigap Plan A only includes core policy benefits. You don't have coverage for many things like Part A deductible or extended skilled nursing facility care. Another downside of Medigap for those under 65 is that the premiums can be significantly more than those who are over 65. You could end up paying up to 4 times the amount in a monthly premium for your Medigap plan than you would if you were 65. This is because carriers know that you have a disability and consider you high risk financially. They know they may end up paying more out of pocket for your healthcare costs than they would for someone over 65. Another issue is even if you find a premium that does fit into your monthly budget, it's common to see very high rate increases year over year for these plans when you're under 65. The alternative option to a Medigap plan for those under 65 is a Medicare Advantage plan. With Medicare Advantage, everyone pays the same rates, regardless of age. Medicare Advantage premiums are also much lower and can sometimes be even zero. In addition, Medicare Advantage plans usually come with lower rate increases year over year, even if you're under 65. There's also no health questions to enroll. Unlike original Medicare, Medicare Advantage does come with a maximum out-of-pocket limit. They also come with extra benefits such as dental, vision, and hearing, and even transportation. Some even come with an over-the-counter pharmacy card that you can use for items you can purchase at your local pharmacy. There's just a few important things to know if you choose to enroll in a Medicare Advantage plan. With Medicare Advantage plans, you can expect to pay some out-of-pocket cost as you use the benefits. This can include a copay and coinsurance when you visit the doctor's office. You'll also want to make sure that all your doctors are included in the plan's network. Some of them do come with prescription drug coverage. Just make sure your prescriptions are covered under the plan. Since original Medicare doesn't come with a maximum out-of-pocket limit, having some form of supplemental coverage is better than none. So having a Medicare Advantage plan is good, but it's not great. If you're on disability and the premiums for Medigap plan are just too high, the good news is you'll get a second open enrollment period to enroll in a Medigap plan when you do turn 65 years old. So if you choose to stay on a Medicare Advantage plan until you reach 65, you can switch over to a Medigap plan within that 6-month time period you are 65 years old. You won't have to go through medical underwriting and your premiums will be much more affordable. We hope you found this video helpful. If you did, don't forget to subscribe to our YouTube channel. Make sure notifications turned on so you're notified each time we upload a new video. We also have a fantastic community on Facebook. We'll include a link in the description below so you can join. Until next time. Bye!